All right, let's get started. So, again, my name is Erin Capel, and on behalf of the Center for Community Health Alignment and our partners at Envision, we welcome you all and we thank you all for joining us today. We really love seeing you all coming from all over. So please put those introductions in the chat. We'd love to see that. Today, the webinar we're talking about today is called The Missing Ingredient in CHW Program Success. Now, some of you might be wondering, I told y'all about the food, but we're talking about recipes and ingredients during this webinar and technical assistance. I told you all we all have this thing common, and we have a common theme of food, but some of us love to cook, some of us burn toast. I'm not going to say anybody on this call that might do that, and some of us might like the DoorDash, and I won't say that person either. But anyway, I have no judgment, but the whole point of us is really understanding the different ingredients, and it ends up with a good meal. So guess what? It reminded me of CHW program implementation. We have organizations that have funding, they have training, they have partnerships, dedicated staff, and these are all different important ingredients. But guess what? Having those ingredients is not going to just make a meal. So what we're trying to do is really talk about how we can bring all of those ingredients together to really make sure that your programs are very important to, move from the actual plan to the practice and making sure that you all are successful in your work. So today, you know how I am. I am going to be womp-womping today. As you know me before, I was talking about I hate womp-wompers, but I have to because I am the facilitator. But we like to be interactive, and we love to use the chat. So please utilize the chat when we ask for questions. We really would love to engage our entire audience. Kim, is your hand raised because you have a question, or are you just saying hi to me?
Oops. But hi.
No, you're fine. Hi. Next slide, please. So before we get started into the nitty-gritty, I will introduce you all in regards to who we are. The Center for Community Health Alignment. That is where I currently stand, actually in both of these pockets here, organizations. First off, the Center for Community Health Alignment. We are a community engaged organization that is supported by the University of South Carolina, Arnold School of Public Health. Yes, say that 500 times fast. I think I've gotten it down by now. But we are led by CHWs, and we partner with community leaders, CHW health worker organizations, health departments, you name it, we have probably supported. If you have a community health worker program or initiative that you're trying to start in any realm, we probably have met with you, but we really want to support capacity building in regards to CHW's allies and our organizations that we support. Alongside with the Center for Community Health Alignment is Envision. We are connected with them as well, and we are a partnership with the CHW, which is Center for Community Health Alignment, along with LSU, the Population Health Institute at the University of Wisconsin, and the University Department of Health Services. So together, Envision supports CHW workforce sustainability through training, technical assistance, learning collaboratives, communities of practices, and system change efforts. We have been doing so many. Many of you are on the call probably have been to an Envision webinar. If you aren't new to this space, give me a reaction. I know Envision and Teacher have webinars, so please give me a reaction if you have. This is not one of your first rodeos for Envision or webinar or Teacher webinars. You know how we are. Very engaging in our teaching. So thank you all. Thank you all for being a supportive of both organizations. We really, truly appreciate that. Also, one thing that I do appreciate about Envision as well as CHW is we are made up of CHWs and allies who spend years doing this work. And what we really want to make sure is that those years of doing this work and being experts in the field, we are supporting those that may be new to it, are currently in it, or even experts in themselves, but really supporting the standard of CHW across the board.
I ain't seen Kim in a long time.
Well, somebody didn't see Kim for a long time, but I would love for you to put yourself on mute. And thank you very much. Kim, somebody hasn't seen you in a long time. All right, let's go to the next slide, please. All right, so let's go over today's menu. I know y'all like, so who here likes to cook? I can't cook. I'm telling y'all that now. I'm the DoorDash girl. I'm so sorry. I had to tell y'all my business, but that's okay. You know how real I am. But today's recipe, I think it's easy to follow. We're really going to talk about what is going on with the technical assistance landscape across the country. Yes, I said that, not just in Delaware, not just in South Carolina, but across the country, which I'm excited to show you all where the programs probably get stuck. Really, what TA is about? What is it? What does that process look like? Looks like. We also, I am so excited today because we have some experts on board today. I mean, we got some good heavy hitters in the building today. We have a provider, TA provider of Spotlight with three different organizations, I'm so sorry, to really highlight what they've been doing, some of the things that they've been hearing across the board, and the supportive TA that they provide for community health worker programs. Next, we will have someone who actually has experienced TA individually, cultivating those different things that they had needs, and just showing the impact of TA for their organization and their program. And last but not least, we're going to talk about funding, how you can incorporate that into your funding needs and your different budgets and things of that nature, and any next steps that we all could be move forward collectively. So before we go on, in the chat, thank you all for your introductions. We have people from all over, as you guys can see. What is the hardest, right now I call it the ingredient, but what's the hardest ingredient to get right when building or expanding CHW programs? Think about off your own personal, experience, you coming into creating a CHW program, you're in one right now, you're like, oh my gosh, where we go next? Give me some examples in the chat so we can see where everybody is thinking in regards to what is really the hardest one. Finding funding that fits into our program rather than fitting our program into available funding opportunities. Jamie, I think you pulled that from my notes. That sounds so good. You are absolutely right. That funding piece, yes. Understanding the challenges and getting the funding for that. Gathering data for productivity. Oh my gosh. Funding, yes, funding is the buzzword today. Other team members understanding our work and roles. Come on, Julie, with the come on. Yes, I love that. Hiring the right people. Look at all these agreements you guys have. Yes, come on. One more for me. Give me one more. Accurate community assessment needs for the right people. Come on, Natasha, do I need to have you guys teach this for me? I love this. Okay, awesome. You guys are all correct. These are all different areas. As you all see, your colleagues in the chat are agreeing with you. You guys are getting hearts and thumbs up. So people are really feeling that too. There are some hard parts. But we're going to talk about some of those things and across the board of where we're going. Can we go to the next slide? All righty. So when we think about successful CHW programs, there are some ingredients that almost always make the list. We talk about training, we talk about program design, leadership and supervision, partnerships. I heard about 3 or 4 or 5 people in the chat saying funding, and I heard somebody also talk about data and evaluation. Most organizations know that these ingredients really matter. The challenge, though, isn't knowing what ingredients belong in the recipe. It's actually getting them to work together. There's a really big difference between having those ingredients sitting on your counter and having a meal that everybody wants to eat. So some of these ingredients are very, very necessary, but guess what? They're not going to put themselves together, right? They're not going to do it automatically. So what happens is this is where implementation support is so, so important. And we really, really want you to understand that what we have here, these are all the pieces of the puzzle in regards to putting a great, great meal together, but we want to know what support will your organization need. You guys can put that in the chat. What are some ingredients or what is something here in regards to your particular organization? What do you need support on? Actually, no, the first one says strongest. What do you guys think you're good at? What right now is you're really, really good at? Are you really good at the training aspect? Are you really good at the program piece? What do you think you're really good at within your organization? You guys can use the chat if you want. Oh, you guys aren't good at anything? Y'all out here because y'all need some help? Program design. Okay, I thought so. Program development and research. Program design, leadership and supervision. Guess what, y'all? I did that on purpose because you see those people putting in, those are the people you want to message on the side and say, how good are you on? Let me hear what you got going on. That's how you connect. I tell y'all a little secret, those networking pieces. There is a chat that you usually can message somebody. So these are people are saying that they're really good at this in their programs. These are ability right here in our chat. You can connect with them. Like, how is your training? Why do you think you're so great in there? What are you doing in your program? These are great ways to connect. We already kind of talked about support, so I'll skip over that. But I also want you guys to utilize these webinars and things of that nature to connect outside of this space as well. Let's go on to the next slide. Because some of the things that you're saying, guess what? A lot of other people across the country are saying the same thing. I know this slide is very, very, very busy, but there's a reason. And the reason is we actually conducted the research for you all. And when I say that, we reached out to the entire country, as y'all can see, with 48 states that have responded, including DC and Guam, in regards to CHW capacity building. And in that particular survey, we really, really wanted to navigate and see what organizations needed for building CHW programs. Where were the problems? What were some issues that they were talking about? There's just some information here on the slide. And again, this webinar is going to be recorded and the slides will be available so you guys can reference this at a later time. So I won't go through everything, but I do want to elevate the different topics and the modalities or the ways we want to support those CHW programs, those different ways, because guess what? You are not alone. There are all these other people that are saying the same thing. So a lot of them, and you guys said it earlier, those funding strategies, how can we get some money to support our CHW programs and really be successful and sustainable? 79% of the respondents said that. That is major. We also talked about CHW leadership development. That is a huge thing. I don't want to always be a CHW forever. That might be somebody's mind. Somebody might be saying, I want to be boots on the ground, but how can I elevate? How can I don't want to just be a supervisor. I might want to do policy writing. I might want to do this. How can I elevate in the CHW workforce, in my scope, me being a CHW? Another one is addressing the social drivers of health. Most of you all probably know it as social determinants, but just changing the different things of the landscape. We want to make sure that we're going on with the time. So social drivers of health, how am I helping my community? How can me as a program, as our organization, as a CHW, as an ally, as a funder, how can we support social drivers of health of the community's needs? Program evaluation and impact measurement. Our CHWs go out in the community. How am I tracking? Is it impactful? Does the community really enjoy them? Do they really get the needs and the resources from their CHW work? Is this really an impactful program, or we're just doing it just to check off a box? How do you actually evaluate that, measure that, and show the impact, which is a very, very important word to others, not just in regards to your organization, but funders, partners, everyone else, and especially the community. That's very important. And last but not least, which is a great one, I'm so glad that people are tapped in, is the community engagement and partnerships. That right there is the key to community health workers. If you're not engaged with the community, if you're not partnering with anybody in your community, in your town, and even not even just your local, your regional, even nationally, you're not doing community health worker. The work is about the community. You need to be tapped in. It's not what the CEO thinks he feels or whoever feels like they're directing you. The community drives our work, and that is what makes us so different. So I want you guys to realize that community health workers have a lot of these different questions that come up. And then last but not least, just want you all to know the different ways that people feel like they can be supported are through webinars, a national CHW learning collaborative, or also individualized coaching. So like if you meet with someone saying, hey, I really need some help with workflows, can we meet and talk about that? That is what that is referring to. So, with that being said, Kara Wortman, I know she has it on here. I just want to open up the floor really quickly. If there's any questions about this survey, she is here to support those questions. We all as a group, CHA and Envision, we did this needs assessment together, so we are able to answer any questions. But for right now, is there any questions related to the survey that needs to be answered at this point? And if not, we can move forward. But I know this was a very, very important needs assessment that we have conducted, and we're very, very excited about our results. I'll give a second. I love the chat. I tell you all the chat, it keeps moving, and I love the connections. I got somebody. Okay, guys just commenting. Any questions about the survey data? All right, y'all know I don't mind silence, but I will move forward. If you do have any questions, please, again, put them in the chat. We'll make sure we'll address them at the end. All righty, we can go to the next slide. So for the people here, many of you all, when you all registered for this particular webinar, there are a couple of questions. And I also kind of gauged you all earlier, but we're going to actually populate a poll right now within the Zoom. I want you all to answer which finding or which one that slide we just showed in regards to all the different areas of support that are needed. Which one do you feel like your CHW program, one that you might be trying to create, one that you've been working on for a long time? Rich, if you could populate the poll, if you guys could fill out which one do you all feel like you are more related to, it feels like this is something that will help strengthen your CHW program, your initiative, and things of that nature. All right, so it's a real-time poll, so you guys will see it. I'm seeing it move. I love it. I love the interaction. Thank you. Funding and sustainability is getting up there. I see it. All right. Let you guys get a couple more minutes just to answer. All right, we got 59%. We could do a lot more better than that. That's just a little half of us. Let's get to 75, and then I'll report out the findings. As you guys can see, it's in real time. I'll give you guys 30 more seconds. 75% at least. Let's go. Almost there. Only a couple more people. All right, I need about 4 more people, and then we can close this poll. You guys got it. Y'all can make it to 75. Give me 2 more people, guys. There we go. Thank y'all. All right, so it's clear. Funding and sustainability was the #1 area. I tell you all on this call, I wish our organization, even me out of my own pocket, I'd be like, here's $1, here's $1, here's $1. That's not necessarily how it works. but we will talk about the different funding opportunities and sustainability efforts during TA when you get that technical assistance from organizations. Those are different opportunities that we can actually go down. In this webinar, I just want to not put deflate your balloon. We won't go into depth about that, but we will have a little snippet about the importance of that and how you can actually be creative in supporting getting that TA into your programs to help identify those funding and sustainability opportunities. The next highest one is partnership development. We are really, really big on that, as you all can see. We'll go to the next piece, the connections that we have. And last, and I'll go to the last one, is CHW workforce development. That is very, very important. We are really, really big on uplifting the CHW workforce standards across the board and nationally. So thank you all for participating. I appreciate that. So I did go a little bit over time, but guess what? You guys are in for a treat because our lovely Julie Smithwick, she is the Executive Director of the Center for Community Health Alignment. She is probably not a stranger to most of you on the call, but she's really going to talk about the implementation of TA and really unpacking how this works and really how TA can be supported to our group. So I'm going to turn it over to Julie.
Yeah, hey everybody, good afternoon. My name is Julie Smithwick. I'm a CHW and I have been in the CHW field since the late 90s. So I'm showing my age, but it's been almost 30 years that I've been in the CHW field. And I'll tell you, back in 2005, when I started a community-based organization of community health workers, I was the only community health worker at the time. I was by myself, and I got a little bit of funding to hire another person so that that person could continue doing the grassroots work alongside me, and then I could work on expanding the organization as well. And I just remember going to the library, to the internet, trying to find anything on community health workers and picking up the phone and calling organizations and being like, how do you do this? How do you get funding? And I'd call somebody else and that I found in a research article, and I was like, how do they get training, and how do we know what to train community health workers on, right? And then I'd call somebody else up or do an internet search, which there wasn't a whole lot about community health workers back in the early 2005. There's a lot more now. But how do we talk to funders about this work, right? And how do we measure it? And I had all these questions. And when I finally found the APHA community health workers section, I was able to get a lot more of those answers in one space. But still, I had to go to APHA and ask people, right? How I would have loved if back in those days there existed the organizations that exist now. I know they do, but now we're more, there's more capacity. How I would have loved to have been able to ask for technical assistance from a lot of these folks to say, y'all teach me how to do this because I'm new, right? Or I really want to do it well. And so how do I do it well? Not just do it, right? But like, how do I do it well based on community health workers and allies that have been in the field longer than me? But back then, we didn't talk about best practices as much or technical assistance, right? I mean, folks did, but it wasn't nearly as available as it is now. So what we're coming today to talk to you about is how technical assistance is something that is everybody needs. I needed it at the very beginning when community health worker associations are getting started. Like, I was one of the co-founders of the South Carolina Community Health Worker Association and then the National Association of Community Health Workers. We needed technical assistance. We went to partners and folks and said, help us figure these things out, right? And it doesn't mean that we're not good at our jobs. It actually means that we know there's expertise out there that we want to lean on to help us do the best job possible, right? So it's not just about implementing CHW organizations, it's doing it the best we can, but also leaning on folks who have been there before so we can do it more easily, right? More quickly, and utilizing best practices from the field. So I think, Erin, I think you have a slide for me or a couple. Okay, so again, as Erin mentioned, and as you guys said in the chat, and as the survey that was shared said, programs and organizations, we get stuck. And sometimes, like you look at this recipe over here, right? Like they're trying to build cookies and they're like, okay, it's really like goopy and something messed up. I remember when I was a little girl and I tried to make brownies for the first time, and I read the back of the thing, back of the box of brownies, and it said 2 tablespoons of oil, and I put in 2 cups of oil, and then I go to make my brownies and they were really oily. And my mom was like, "Oh, these are lovely, darling." They were not lovely. They were disgusting. My mom was trying to be nice, but then she helped me like read more closely and was like, "Maybe you need to slow down and look at details." Those of y'all who know me, you know that's a thing and still a theme in my life. But implementation and making recipes and making programs and making organizations, it can be messy, right? Sometimes the roles don't line up. For example, somebody onboards a CHW, or we're hired into an organization and everybody's really gung-ho about having a CHW, but the leaders of the organization don't know what we're supposed to do, right? Or our supervisor may never have ever worked with the CHW before and doesn't know how to support the CHW. Or it may be where like the partners are like, where's the CHW in the clinic? And they're like, well, the CHW is not here today. And they're like, well, why aren't they working? Well, they are working. They're out doing a home visit, right? But sometimes folks don't understand that. And then sometimes we have all of these great ideas and we write them down and we've read about them and we've got our model down and we figured it out. But then it doesn't always work that way in practice. And we're like, I don't understand, because we had this all figured out, but something's not gelling, right? Like maybe me as a CHW, I don't feel like my work is understood, or a supervisor is like, something's going on there. The organization, maybe there's a disconnect, or maybe, like you guys said in the chat, maybe it's a confusion about how to collect the data to show how important our roles are, right? Or where to go for the funding so we're not worried about going from grant to grant. So as you'll see down there in the yellow, it's not a failure of commitment. The fact that I put 2 cups of oil in those brownies, it's not that I wasn't committed, but I needed support and I needed to slow down and I needed to get some help from somebody who had cooked those brownies before. Okay, next slide, please. So what we wanted to talk to you guys about today, this is not a commercial, by the way, y'all. This is not a commercial trying to sell y'all nothing. It's literally because we have learned that if you lead, because just like back in 2005, when I was starting an organization and realized like I didn't know all the things and I needed to reach out to people who knew them better, we have realized that the more we lean on one another and we lean on people who have done this before, the better our work can be and the easier we can make it for each other. So a lot of times we talk about technical assistance as the missing ingredient, because we can have training, right? And we can have a position that's created for a grant or whatever, but it doesn't necessarily mean that it's all going to gel and work together. Okay, so what is technical assistance? Technical assistance is hands-on support in helping you implement your program, your organization, your initiative in a way that is leaning on folks who have done it before. You know, and ideally, you want to make sure that in those folks that are giving you that expertise and that advice, that there's a CHW in that mix. Because as CHWs, we want to make sure that there's expert CHWs that are giving us our technical assistance. And it's not just folks outside of our workforce that are coming in to tell us. Now, I'm not saying we have fantastic allies. We love our allies. We need our allies. We need all kinds of folks with all kinds of expertise out there. But we also want to make sure that they're doing it arm in arm with the CHW, because we're the ones that get the work, right? Like we're the ones that understand like how it plays out on the ground. All right, next slide, please. So what does it look like? So TA in practice basically is somebody that walks alongside you and or your team or parts of your team, right? To help you figure out, okay, what's going on here? Let's diagnose and figure out, like sometimes you may come into TA and you might be like, okay, let's say that you are an athlete, right? Or you're in the gym and you want to get a personal trainer. Sometimes you go to that coach or that personal trainer and you might be like, okay, I need to work on funding. Or you might say, okay, I need to work on program implementation. Sometimes you're just like, I don't know what I need, or something is just not working, right? So sometimes it helps to start in the assessment and the learning phase. And usually we suggest, like we do technical assistance, and we'll say let's start in like the assessment and the learning phase. Talk to us about your program or your organization. Where are you getting stuck? What have you tried? Where do you want to focus now? What are your options? And then we start saying, okay, now, given what you've just said, we've got a database and partners, some of which you'll hear from in just a minute, that can help you with these various components. And so we'll connect the dots and be like, you know what? You talking about like how to design evaluation? You need to go talk to the CHW Center for Research and Evaluation that you'll hear from in a minute, and we can help connect you with that, right? Sometimes it'll be, you know what, let's let you talk to a CHW that's been in the field and has worked in your setting before, or maybe a CHW that has helped form a statewide coalition and you want to learn how to get through some barriers to forming your coalition. Let's connect the dots there. They'll learn about where you're stumbling, where your gaps are, where your strengths are, and then help you design a plan. So it's really about aligning people, aligning expertise, aligning learning, and again, helping you do the best work that you already know how to do. You just need some support and a shoulder to lean on, and maybe a coach that's kind of cheering you along the way. That's really what TA is all about. And I think that is it from me, Erin.
But you can continue with the slides. Thank you. Thank you so much, Julie. Thank you for giving us that background information in regards to really what technical assistance is about. So this is the most exciting part of my day. I mean, I love to hear Julie. I love to see everybody else's faces on here. That's not only, but this part right here, you all are in for a treat. We have 3 organizations, national organizations, that continuously support technical assistance across the country in regards to CHW programs in different areas. So I would love to do some introductions. These are some great people that we work with very closely. We have really great relationships with, and guess what that shows? We are all technical assistance providers, but we all work closely. We collaborate, we partner on things, and that is the key. We do not want to be siloed. So you know I can talk, so let me make sure I do the introductions. This part right here, this is the first person I'm going to introduce is Lisa Renee Holderby-Fox. She is the Executive Director of Envision and the Associate Director of National Initiatives at the Center for Community Health Alignment. Envision is a national partnership, as I told you all before, in regards to relating with CHW, LSU, and Wisconsin, really strengthening CHW workforce sustainability through our training, technical assistance, learning collaboratives, and all the other things that we mentioned earlier. The next group that we'll be joined with are representatives from the National C3 Council. So many of you probably have heard or referenced the C3 standards. You probably have already benefited from the work, especially if you're doing accreditation, certification, building those trainings. We have 2 great representatives that are beautiful souls, but they are coming from the National C3 Council. They really define those comprehensive CHW roles, those skills, qualities, and they establish the national consensus around the CHW standards. They continue to advance best practices for our workforce nationwide. So today, joining us today is Paige Menking, and she's a member of the C3 Core Leadership Team, and Devin Abden, which he's also a CHW, but he's also a CHW fellow with the National C3 Council. They are currently developing an accreditation process for CHW capacity building organizations and programs, which really includes a lot of opportunities for personalized technical assistance to strengthen curriculum, processes, and implementation efforts. And last but certainly not least, a great, great, great person to know, expert, and she is so intelligent. I just love having conversations with her. Victoria Adewumi, she just got me on me by her last name earlier, but I make sure that we say people's names correctly. She is the co-principal investigator and the co-executive director of the CHW Center for Research and Evaluation, also known as CHWCRE. CHWCRE advances the CHW workforce through community-based participatory research, workforce capacity building, common indicators. I know a lot of you probably have heard of that, employer and CHW surveys, and evaluation approaches developed with and by community health workers. So before we get started, I want everybody to give some love to all of our panelists, show some reactions, and welcome them to our webinar today. Thank you, thank you, thank you to you all. All right, let's get started. So how I'm going to do this, I'm going to say 3 questions, and I'm going to give each organization a short piece to answer these questions. I'm not going to do a shout out like individualized. We're just going to do a group just because of timing, but I want to make sure that they have the opportunity to answer and have that ability to talk about their organization. So the 3 questions that each organization I would like for you to answer is, what hands-on support do you provide? We can go to the next slide, Rich. What hands-on support do you provide? Who do you most often work with? And how do you make sure your technical assistance stays grounded in CHW best practices and lived experience? So, LR, I'm sorry, everybody. I call Lisa Renee LR. LR, you'll start off with you with Envision.
Thank you so much, Erin. And, I just want to say you and Julie did a fantastic job of setting up this panel. So thank you so much. So I kind of want to start off by telling you the type of TA that Envision offers. And we provide individualized and group technical assistance. We do that virtually and also in person. And everything that we do is really to help you to promote sustainability of your program and the CHW workforce. And we do that through knowledge building and building capacity and support. We offer tools, resources, and then coaching to help you understand and utilize those tools and resources. Our goal is really to assist organizations to be successful for the long haul, right? We're not saying, hey, we're going to come in, we're going to help you so that for the next 6 months, y'all are all set. But it's really about helping to build capacity and walking alongside with folks. The kinds of organizations that we've worked with in the past have been CHW programs, CHW organizations, and health departments. And we also work with other organizations, but those are 3 primary groups that we've worked with. And we've worked with organizations in most states, including on opposite ends of the country, right? From California to the East Coast to Alaska and Hawaii, which is pretty exciting. We've also worked in many of the U.S. territories, the freely associated states, and many tribal entities. So, this really goes to show that no matter what kind of entity you are, if you're working with CHWs, you can probably use a little bit of technical assistance. And as Julie said earlier, no shame in that, right? It's about really uplifting and moving your program to the next level. I also want to say that, while this is slightly different, we also work with programs and organizations who have not yet started CHW programs. They might be thinking about it. And when I say thinking about it, not necessarily thinking about doing it next week, but you know what? Sometime in the near future, we'd like to do more with CHWs. And so we're able to work with those organizations as well. And then what guides our TA? I love this question because, I wish I had TA very early on. And everything that Envision does really draws from best practices for the workforce. And it starts with nothing about us without us. And I say that because everything that Envision does in the way we provide TA engages CHWs. Um, no resources developed, no TA provided without CHW engagement, right? We realize that CHWs have walked the walk. And once you've walked the walk, it's so much easier to offer support, guidance, and coaching. Um, and most of our team are CHWs, which is really exciting. Again, CHWs and allies working together, but the majority of us are CHWs. And we don't invent strategies. We uplift those and promote best practices and help you engage and utilize those best practices. And when we provide TA, we're walking right there with you, right there alongside. We don't make recommendations or hand you a resource and be done with it, but we really and truly offer some coaching to help you through that. We know that organizations have strengths, and we want to help uplift those strengths and coach and move you to the next level. And then I just want to end with saying, just like CHWs on the ground, Envision and other TA providers, we meet you where you are and help you to get to where you want to be. Thanks, Erin.
Thank you so much, Ella. We appreciate that. Those words. You can keep the slides up, Rich, if you want. Next, we're going to tag on over to C3. I'm not for sure if Paige or Devin is taking over. So, Paige, go ahead. Thank you.
Yeah, I'm going to get us started. Hi, everyone. Thank you so much for having us. Thanks to CHW for inviting us to be on this panel. I'm excited to share a little bit about what kind of TA C3 offers. So it's important to note that the National C3 Council, we have been around for a long time in various different kind of forms of capacity. But right now we are a group of folks who, for the most part, volunteer our time, but we are working on trying to solidify more of some more official TA offerings, in addition to what we've been kind of doing on an informal basis. And that includes our accreditation process that we are working on building and hoping to launch in the next year. So we really are working on specifically providing that TA in the CHW curriculum and accreditation space. So providing, assistance around whether your training program for CHW core competency training is really preparing CHWs to work in the full scope of their practice. So are you including all of the potential roles that CHWs could be doing? And are you training them in all of the skills that they need in order to be competent at that work? And are you recruiting CHWs who embody all of the qualities that we know make CHWs amazing at the work that they do? So a lot of our work right now is TA around that curriculum creation, around the review of curriculum if you are setting up a certification or accreditation process or a credentialing process in your state, and assessing whether your program is using all of the C3 core roles and skills. So really, our CHWs in your programs and in your capacity building programs, are they taking advantage of the full scope of the C3 standards? So that's a big part of it. We also, everything we do is really guided. So those best practices that we pull from is really this idea of consensus. So nothing about us without us really drives the work that we do. And all of our work in the past has really been driven by this idea that the CHWs in the field should be driving all policy and research and advancement of the workforce. And we support lots of different types of organizations. So as I mentioned, lots of training organizations or state health departments, associations who are setting up credentialing processes, or training sites who want us to review their curriculum. So credentialing programs, training programs, health departments, CHW employers and organizations, we really run the gamut when it comes to the CHW scope of work and building capacity for community health workers. So I think I covered most everything I wanted to say. Devin, did you want to add anything?
I don't think so. I guess I don't think so. I'm going to add something. I think the new committee structure that C3 has built out in this increased capacity with CHW fellows, the accreditation process itself that we're working on falls under one committee. The whole C3 team is a part of it. But then also with what we are moving forward, it's called a CHW circle, who will really lead some of our TA requests more formally and directly. But other than that, I think Paige nailed it. I'm also new to this as a CHW fellow at C3. I'm not new to the work of C3, but new to C3. So,
although it's been about 6 months now, Devin, so I'm not sure you can say you're new so much anymore.
Fair enough.
Our time is short. 6 months is a long time in the CHW world. It's like
I tried.
All right. Thank you all. Thank you so much from you, both Paige and Devin. We appreciate that. And last but not least, Victoria, we would love to hear what CHW CRE is doing and all the information here. So turn it over to you.
Erin, thank you so much. Thank you to all the other panelists and folks who have just provided such incredible information. As Erin said, my name is Victoria Adeomi. I'm a community health worker, and I also have the honor of serving along with my co-director, Dr. Noel Wiggins, who I know is in the Zoom room, as well as one of the co-directors of the CHW Center for Research and Evaluation. And we exist to do three things. Number one is to support CHWs to lead the research and evaluation about our profession. I came as somebody who 2 years ago was very, 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 very new to research and evaluation for the CHW workforce, but who had been in a direct service role for over a decade. And this idea that we as CHWs are exactly the ones, I love what Paige said, they should be defining for our workforce what works, what doesn't work, and also informing individual programs, but also the field nationally about how CHWs are able to achieve the extraordinary things that we know we're able to achieve. And so that is a huge part of what our center exists to do. We also support independent research with and by CHWs to be able to, again, advance this important work and this important perspective of CHW leadership in all aspects of defining our workforce. And something that we're also intensely proud of is building and developing and disseminating broadly what Erin already referred to, the CHW common indicators. And the common indicators are really special for us because in this moment, I think you all know this, we're in a really powerful time, but also in many ways a vulnerable time. Some of our OGs among us know that this is not the first time that the CHW workforce has faced challenges, especially related to funding. And because the challenge is so acute, the response for us as CHWs is so important to be able to say this is what matters in terms of our workforce, and this is how we should be measured. My CHWs on the call, oftentimes you have heard, if it is not documented, it did not happen. And so for us, being able to support programs, to support associations, to be able to do the incredible storytelling that's so vital, to be able to convince, even though, again, there's over 60 years of proven, documented historical research about the efficacy of our profession. If we were a drug or a medical intervention, we would have had FDA approval years and years and years ago, right? We've already proven we work. Unfortunately, we still oftentimes have to tell that story, and being able to have really strong, robust evaluation systems to allow that to happen is paramount for every single program. And so in terms of hands-on support, we help programs build evaluation systems, evaluation plans, Unfortunately, evaluation is sometimes something people forget about until the very end when that funder report is due or when they need to be able to demonstrate to leadership that their CHW program works. And so we come alongside folks at the beginning, ideally, to be able to develop their system and ensure that they're able to demonstrate success and do the continuous improvement that's needed for our programs. And we also love working with CHW associations, state and local health departments, international organizations as well, sort of moving into that second who you support question, getting to do some really cool work abroad as well, but essentially getting to work with all of these associations and programs and organizations around what it looks like to develop and implement really strong evaluation programs and evaluation systems, and using those common indicators in powerful ways to be able to do some of that measurement. And so when I think about what guides RTA, I'll tell a really quick story. We were working with a CHW program just a couple of years ago. And I know I came out of a CHW program that sort of felt like they invented CHWs, that it was a brand new thing that nobody had done or discovered or known about before. And the idea that CHWs themselves would be the ones not just doing the data collection, right? Not just doing the survey with the participant, but they would be the ones really identifying what are our process and outcome evaluation questions? How are we building the team that's going to lead and guide the evaluation? How are we supporting the analysis and interpretation? How are we reporting the results? That wasn't necessarily something that was really common knowledge or really easily understood by folks. And so being able to do that in our work, so we have a leadership team that guides a CHW, majority leadership team that guides all of our work. We're also really proud of the fact that we are supporting research that is protecting the essential aspects of our workforce. Again, so grateful to our partners at C3, really saying that CHWs need to be playing a full range of roles, but unfortunately, reimbursement sometimes favors one or two roles, not that full complement of roles. And so being able to do research and evaluation with programs and associations and other partners to really say this is what works. And again, going into our statewide association, health departments and association friends, and saying this is a snapshot of the workforce. This is who we are. This is, especially thinking at the state level, these are the parts of the workforce that are really thriving, and these are the parts of the workforce that might need support. And then working with folks to be able to bolster all of what is already working really, really well, and also strengthen in the areas that might need a little bit of extra assistance. So I will stop there, but I'll invite my co-director, Dr. Noelle Wiggins, if there's anything I missed that you'd like to add or share.
I just added our website link in the chat, Victoria.
Oh, no, well, I got you. I got both of you. I have all of your information, your contact. I got you. So everybody, if you notice, after every organization spoke, there are the resources or contact information in the chat. Please utilize that. We talk about recipes. Oh, my face just got really big. But we talk about recipes and things. Write that down, copy, screenshot it. But these are the connections that you would like to make if you want to have further conversations after this. We're not finished with them yet. We have about one more round of this, but we're going to do a rapid fire because of time, because guess what? We got a lot more to go. So with that being said, Rich, you can share the slides again. I'm going to ask each organization a question, and I just want you guys to provide a good answer in regards to these questions. So first off, I'll start off with LR again. In regards to this, because this is the part, I don't know if y'all know, but I'm a nosy girl, and I'm nosy for a good reason. I want to know the real tea so I can really figure out what the problem is so we can really know where we can work from. So that's just me. So this is my nosy question that I can ask this all out loud. So LR, I'll start off with you. What is the common challenge? What implementation challenge have you noticed shows up a lot during those TA sessions and when you're having conversations with other organizations and other people?
Yeah, thanks, Erin. So I think the biggest thing is that individuals and organizations underestimate what it really takes to get a CHW program up and running and then sustaining that program. And I'm talking everything, right? The whole package from organizational buy-in and readiness, recruiting, hiring, retaining the right CHWs, ensuring the CHW team is integrated into the bigger organization, and so on and so on, right? It takes a lot to stand up a program to make sure the folks are integrated into the bigger organization. And it takes much more than desire. I think if it was just desire, everybody would be successful, because I really believe that folks want to have strong CHW programs. But really what it takes is thinking through, thinking lots of different aspects, having a plan, and having someone walk alongside with you to help you implement that plan. And I just, think that for most of us that are here today, we're all in unique positions to do that, right? Because we have CHWs and allies who have done the work. When I look at even the Envision team, we have centuries of years doing this work when I put all of our time together. And that's across the board for the other providers here too. So yeah, it's underestimating.
Thank you so much, LR. We appreciate that. I told you, these are some things, you got to ask these questions. Devin or Paige, what has TA taught you or either one of you about what programs really, really need?
Yeah, thank you, Aaron. I would say, and this is kind of threefold in one, but I think what I've seen personally would be there's no getting around the need for a solid TA foundation when you start a CHW program. But I think there is this ongoing need to be able to do and receive TA on the fly, right? Like you've got to be able to adjust and move forward when you haven't in the past, or when you created a whole CHW program without any CHW input. How do we keep the CHW program and get CHWs to the table in like a meaningful way? So when I say like TA on the fly, it was an idea that maybe there wasn't a solid foundation for TA, but that's okay, right? Things can be improved. TA can be done on the fly. TA can be implemented, and CHWs can be brought to the table. I've seen that personally here at the health department I work at in Columbus, Ohio. The CHW program was created in response to a community health improvement plan. And then we received the CCR 2109 grant probably 2 years into the program. And Envision was a large part of that. And so TA came with that grant. And that is when our program not only began to grow, but really got CHWs to the table. And now CHWs, supervised CHWs, right? We've been able to implement TA on the fly, and we've been able to kind of keep it going. So I would say a little bit of grace is what's needed. It's okay if you missed out on TA to begin with. Could have been better, but we don't have to cry over it. We can just move forward and implement TA on the fly.
I promise you guys, I did not tell them to answer these. These are all from them, but thank you, Devin. I appreciate it. I tell you, this is just what they say. So awesome. Thank you so much for that, Devin. And last but not least, Victoria, I really, go ahead, Devin. You have something? Go ahead.
I was just going to say, Paige.
Oh, yeah. I'll just add really quick. I think one of the other things we see a lot is people creating, I mean, this has been touched on already, but creating CHW programs, thinking they're the first ones to create a CHW program, and like creating a program, not even like doing a little bit of Googling to figure out that there are already standards that exist for what a CHW does and how to train them and how to recruit them, right? So reinventing the wheel when they really don't need to is, I think, something that we're still struggling with in the year of our Lord 2026.
And you got a lot of love in the chat for that, Paige, because that was something that needed to be said out loud. Thank you so much. And last but not least, Victoria, I did save this question for you because you kind of touched on it. And this is the part I always try to tell people about evaluation and data. But the question for you is, what changes when TA is built in early and used well? And I utilize you because people always leave you even said it earlier, evaluation for the end, but that is not the case. So what do you think? What is the impact?
It's amazing to me. Aaron, come on. I could sit on this question all day long, especially because the question you asked, Aaron, at the beginning around what are the challenges that folks are seeing. And every single person, maybe not every, but many people said funding, funding, and funding again. People fund CHW programs that can prove that they work. And so in order for a CHW program to be able to demonstrate robust effectiveness, there has to be some level, and again, we're huge qual data, CBPR, community-based participatory research people out here. So this does not mean that you have to build this brand new quantitatively based system from scratch, but it does say before you begin your program, you're thinking about, so how are we demonstrating success? What does it mean for us to have community-based outcomes that look different than what our communities are currently experiencing? And that to me is so central to the work that's happening within our center that all of these other incredible panelists are also providing. They're saying that it's going to be easier. You're going to save yourself time and money on the back end if you're able to start doing some of this thinking work, whether it's evaluation, whether it's training or standards, if you do that early. And at the same time, I'm grateful because some of our work also looks like, how do we support CHWs to build these skills? So it's not, I love our TA because our TA says that we have expertise, but so do you. That you on the ground are the expert about the thing that's happening on the ground. And you too can become skilled and capable in evaluation or data collection or whatever it is. And so our center, part of what we do is building CHW capacity to lead research and evaluation and researcher capacity to be able to work well with CHWs and help produce evaluation systems that work. So Erin, thank you so much for this question. And again, the perfect CHW program does not exist, but CHW programs that are effective in the places where they exist absolutely do. And that work happens in teams. Just like CHWs have a holistic team-based approach, so does the TA that we provide that's effective and works.
Thank you so much. I want to thank all of our organizations today, all of our panelists. We appreciate your guidance. Again, those of you who are in attendance today, Rich put in all of the resources, contact information. Please check the chat, scroll up if you need to. We can, again, this particular PowerPoint and webinar will be recorded, but please connect with us. We really appreciate you all taking the time out and giving us your expertise in all the different ways that TA can be offered through CHW programs. So thank you. They will still be on till the end for our Q&A. So if you have any specific questions for any individual of the organizations, please stay tuned to the very end for Q&A. So they are going to stick around. So we are going to shift gears a little bit because this is it right here too. I just am so excited about this whole entire webinar because this is real life application. All of the people that are here, we actually are doing this work. We have worked with community health worker programs, but this is the one side. I need y'all to see the other side, the actual impact of TA. So with that being said, I am so excited to bring on these two beautiful women. They are out of actually South Carolina, and they work for Regenesis Healthcare. Regenesis Healthcare is a federally qualified health center, FQHC, working out of South Carolina, and they provide a wide range of health services to the communities to really help improve the access to care and the community's well-being. Really, Regenesis has worked to strengthen and grow its community health worker program while navigating a lot of those challenges you guys talked about earlier, and even some that you guys didn't really even get into. So a part of that journey, we actually were partnered with Regenesis, and when I say we, referring to the Center for Community Health Alignment, CHW, we supported them with TA. And again, this is not a commercial. I promise you it's not that. It's just the support that we provided. And I would love for them to share today, which they will be coming in regards to really before, during, after, and really how it has progressed with the TA and it has impacted their technical assistance. The TA has impacted their community health worker program. So joining us today is Sierra Kelly. She's the Director of Community Engagement with Regenesis Healthcare, and Nakia Ferguson, CHW Supervisor. So please give them a warm welcome to the space. We're so excited to have you here, and I'm going to ask them a couple of questions just to let you all know about their TA impact and how that has really changed their CHW program. Rich, we can go to the next slide, and I can start with the first question. So, Sierra and Nakia, whoever would like to take this question, before receiving technical assistance from CHW, what were some of the biggest challenges your program was experiencing? And on here it says, what was hardest before TA?
Well, good afternoon, everyone. I think the hardest part for us with it before TA was I was new to the department. I've been an ally, I've done the work in other locations, but being at Regenesis Healthcare, I had a wholly different role before coming into this department. And so the hardest part was coming in having one idea and being at tables and hearing the organization what they would like, and then coming in and actually hearing from the department of those who are actually community health workers who have been doing the work, the ideas that they had, how they would like to transition now that they were certified. And so I think the hardest part was that role clarity, but then also how do we want to really define community health and a community health worker staff to fit our organization and where we were going. So that was kind of mine, what was the hardest part before TA.
Nakia, did you have anything to add?
Yes, I was just also going to add, I think the integration piece was also one of our biggest challenges that we had prior to TA assistance. So having this really help us strengthen that internally as well.
Yeah, oh, I remember that. Yes, 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 absolutely. Awesome. I also want to give a shout out, I don't know if she's here today, Alex Scott. She is with the Center for Community Health Alignment Teachers. She supported Regenesis Healthcare as well with the TA. So shout out to her because she is a phenomenal person to also know too. Her brain is amazing. But let's go to the next question. It's all about Regenesis Healthcare right now. What support do you all think made the biggest difference in the technical assistance with your
So,
organization?
yes, I'll definitely lead that one. Again, as I talk about integration, integration was that biggest piece. I think so. Once we were able to find those champions internally with our providers and our leadership staff, I think made the biggest difference. And also using our EHR system to where we were able to document differently so that way our providers could see that documentation, those touch points that we made with our patients and participants as well make the biggest difference. We're closing that loop now that we're able to do that data way better now in the system. They're able to see the work that we're doing so they know that we're touching out to those patients and getting those needs met.
And I think another piece too is that we have community health workers and they're certified, they're doing the work, they are addressing those social drivers. But then on our team, they're also doing a lot of community outreach, handing out a lot of kind of that marketing flyers as well. And having the TA assistants allowed us to say, you know what, let's clearly define where we're going, why we're going, and are those events that our community health workers should go. Because as an organization, those are great things, but it also takes our staff out of the office for a whole day to do a Saturday event or a late evening event, and it doesn't allow them the time to really spend intentional time with the patients that they are serving. And so it kind of helped us also define that piece a little bit clearer for the team, and say this is why we're not, going because it's just a kids are just coming for supplies and it doesn't provide this opportunity, but this is what we can do. And so that also made a big difference for us to have those intentional conversations around those events.
Thank you both. So what, in regards to afterwards, in workflows, communication, any of those things, what really changed? What improved, I guess, in regards to having that TA?
I'll let Nakia take that one since she handles the day-to-day operations.
Yes, definitely buy-in from our CHWs here has been a big one. So now we do those weekly huddles. We do them Monday mornings now. So we kind of do that check-in. I also do my one-on-one check-ins with the team as well. So that way they have that safe space to be able to share their thoughts and ideas as well. And then we still continue to do our monthly meetings as a team as well. Also, the biggest workflow improvement has been our onboarding. So currently doing it right now. So it's been a great piece of help. Actually having that workflow laid out for us, so it's not just scrambling trying to figure out what we're going to do day to day as far as that training process takes place as well. So those have been really big improvements. Also, and then role clarity. Going through that role clarity with the team was really big. Again, it helps with those day-to-day workflows and very just much understanding from the team perspective and also organization wise.
Oh man, wow. Thank you so much for sharing. And last but not least, if you guys can get this in about 30 seconds, and I hate to mince your words, but after all of that is said and done, what is different now? What is the impact on your CHW program within Regenesis?
I think for us going through TA, we know the questions to ask. We know the things and how we need to communicate to even more upper executive leadership around the program, the direction. And so I think that has made a big difference. We now can see things a little bit clearer of, okay, we need to fix this process. How do we share our impact? How we also motivate the staff with our numbers and our data for them to be able to reach to the goals. And so I think that is a big difference of how we look at the department, and not being afraid to kind of speak up as well.
Nikki, did you have anything else to end with?
No, I think Sierra summed it up very well.
Awesome. Well, we appreciate you all both sharing the story in regards to the CHW program at Regenesis. It really just shows they had all the pieces there. They just needed someone to cultivate and really bring out those different things that they were questioning, they weren't for sure. And it really showed that once they implemented and heard the ideas and suggestions from someone that has expertise in regards to CHW programs, it really kind of aligned. And I guess this is a beautiful story. Now, all the time, and I tell them all the time here, Regenesis knows this, that they were like our fairy tale story. Like everything we did, everything worked so well with their leadership. Everything was in alignment. It may not always be that way, but it's always a try. It's always making sure that you have that extra set of eyes for TA in regards to the support. And they always knew that we had that open communication. So thank you all for sharing your story. We are so grateful that you all are putting the support and effort into your CHW program. And again, their information is in the chat if you want to learn more about Regenesis Healthcare. And I know they probably would love to talk with anyone for any ongoing questions or anything like that. They will be in at the end as well for our Q&A. But the last piece, which is very, very, very important, I appreciate Regenesis. Thank you so much. LR is going to really talk about that question everybody was saying earlier, funding. Now, I'm not telling y'all she's going to say I have $1 million for everybody on the call, but she will tell you some creative ways to really understand how you can actually incorporate TA in your budget and your grants or anything like that you're applying for. She's going to get creative, and she's let you all know now. So I'm going to turn it over as a Julie or LR because y'all both are looking at me. Who is it, Julie?
I think it's me. Julie.
Julie.
Awesome. Thank you. I think there's a slide, Rich. Is there a slide on this? Awesome. Thank you. Yeah, so a lot of folks are like, yeah, that sounds great, but how do we pay for it, right? Because to bring in technical assistance, I mean, you think about it, y'all. It's so interesting. I was just having a conversation today about how in the nonprofit world we function so differently than the for-profit world. You know, and like even like big systems, sometimes they'll bring in a consultant and pay them, you know, $50, $75, $100,000 to do a strategic plan and not think twice about it, right? But when we are talking about, you know, paying for training or a little bit of TA, we're like, oh, we can't afford that. But at the end of the day, if you look at it in where you want to get, paying for technical assistance or contracting with an agency to help you do what you want and do it more effectively, more quickly, and get to those outcomes you want to get with your organization is really a cost savings, right? And folks do it, again, like people in the for-profit world and even in our nonprofit world too, hire consultants and trainers and technical assistance providers all the time because it's the norm. Well, now it's becoming the norm in our CHW world as well because we realize wow, this is a lot easier to do if there's folks out there who have already like worked really hard to figure it out, and now I can partner with them. So the biggest thing, we've been talking about food a lot this whole time. The biggest thing with technical assistance is to build it into the recipe from the beginning, right? So you don't want to like, you've got that egg that the recipe called for. You don't want to like build your whole recipe and then at the end throw the egg on top, because that is not going to taste good, right? And it's also going to make the recipe really not be correct, right? Like if you trying to like build something that like a meatloaf that's supposed to stick together and you don't put that egg in there, it's not going to stick together. Even if you put it on top, it's still not going to make that meatloaf stick together, and it's not going to taste the same, right? So the point is to build in technical assistance from the very beginning. You can build in technical assistance and coaching when you're writing a proposal, when you are trying to write your data and evaluation plan. You can write it into your budget. So say you're writing a grant proposal, write technical assistance into your budget from the beginning, as opposed to waiting until you get the funding and then be like, oh shoot, I wish we had, those folks, those Center for Research and Evaluation folks to help us with our evaluation, or I wish we had those Envision people over to help us with the financial sustainability plan, right? Like write those things in at the very beginning. It is going to improve your effectiveness. And one of the biggest things is, how on every grant application, there's always that question about sustainability. And we always go, I got to answer this about how I'm going to sustain my work afterwards. Tell them that you are going to get technical assistance support from the Envision team to create a financial sustainability plan, that you are going to get technical assistance from the C3 Council about how to make sure that your organization and organizations you are supporting are really following best practices, and that your training programs or your organization is really set up to do the right thing by CHWs. All of those pieces lead into higher quality, and funders want to see higher quality for sustainability. So where do we get this funding? Well, some folks have it, they'll build it into their organizational budget. We're about to be in a new fiscal year for a lot of people on July 1st. And people are looking at, okay, like where do we need to put some things into our budget? Do we need some coaching? Do we need some technical assistance? Build that into your budget now. If it's not in there, consider, like, I know a lot of community foundations that have grants over here for different programs. They have different line items or different programs where you can request technical assistance. And what they'll do is they'll pay you. I know an organization here that got $10,000 for technical assistance for their organization. The foundation let them choose who they wanted, but they were able to get that money from that foundation to pay from community assistance. For technical assistance. And then go to some of the foundations. So like if you're at a health system, maybe your statewide hospital association, if you're part of a health department, ask them, like, look, if we're trying to like really build the quality of this initiative, can we use some of our funding and these grants at the health department to apply for technical assistance in this area or in this area? Because why? Because it's going to help us be more effective, have higher quality programs, reduce attrition, y'all, because whenever things flow better and there's better integration of the team, you don't have people quitting because they're burnt out and they're frustrated, right? And it's going to support our sustainability in the long term. So it's actually part of our sustainability plan. So out of all the different TA things that we've talked about today, all the different pieces of like financial sustainability planning, roles and competencies, the data and evaluation built from CHWs and for and alongside CHWs, program implementation, organizational culture, all of those things, leadership, support. Out of all of those different things, what if you could choose one that you build into your next grant or your next organizational budget to be able to support the work you're doing, what would it be? Throw some ideas in the chat. If you had to say, if your board or your funder said, hey, we'd like to support you, or we want you to write into your budget some technical assistance that would help you be a better organization and do even more effective work more easily, what would it be? All right, I see healthcare integration. I see data and evaluation. I see roles and workflows. What else would you love to get some support from CHWs and allies that have been doing this for a really long time and maybe could give you some tricks and tips and support you to get where you want to get? Sustainability planning, data and evaluation, sustainability, that's the hardest thing. Claps for data and evaluation, implementation coaching. That's huge, you know, because as a certified coach myself, I will tell you, I love that model because coaches will help you not only, coaches are there to help you bring out the answers in yourself because you have them, but a lot of times they're hard to get out. So that implementation coaching as you're going through it is a really wise idea too. Anything else? All right, so think about those strategies. Think about like where are some, look out there because there are funders, especially some of your foundation funders, for example, who will support you with technical assistance. I know that a few of us here on the screen as well have some funding to support health systems. I mean, health departments and community health worker programs and organizations with technical assistance. Reach out if that is something that you would like, and feel free to reach out to any of the organizations that are here today. And some of the folks who have put what they do in the chat, let's lean on each other to really help our work be as high as most high as the highest level of quality we can get, working at the top of our scope, right, and be the best CHWs and allies that we can be. All right, I see we already got one question. I'm turning it back over to you, Erin, for questions and answers.
Perfect timing. Thank you so much for Julie. I told y'all she's going to give you a little snippet. She has a lot of ideas. So again, tap into any of the organizations you all seen today in regards to ideas about sustainability, funding opportunities, and things of that nature. But we are at our Q&A time. I have two questions already. I'm going to ask them out loud from Natasha Taylor and anybody on our panel, or even Regenesis if you want to chime in. How do we get someone to review a grant proposal for mental health services? Anybody want to quickly answer that question from the group, the team? I'll answer. Guess what? Submit a PA request. How about that? We could talk about it further. In any one of the junctions, if you're doing a grant proposal, more than likely Feature and Vision will be more of a support for that. But really, if you're talking about, though, evaluation and data pieces, or if you're doing a training in regards to the mental health, that's where it depends on the organization. But really reach out. Ask those questions. I'll let you know from Feature's point of view, we do have a consultation. So you do get 30 minutes of a quick sneak peek. Michelle Lawson, I know I'm calling you out, but don't look at me like that. We had a quick call, and she knows. We'll talk. We'll sit there and get all your ideas out. We'll provide you some recommendations and resources, but we really want to gauge what the type of need you're doing. So just reach out and ask those questions. Next question we had just recently was Jamie. This is a great question, is it ever too late for a program to do implementation coaching, or always helpful regardless of age of program? I think all of our speakers today can answer and take it off and say, no, it's never too late. It's never too late. You can have a program for 10 years. Call one of us. We're not the only TA providers, but you have connections here. Hit us up. We are here. Contact us. It's never too late. Never, never, never too late. So I'll answer that question for you quickly.
No, Erin, it's a fantastic response. Can I add just a teeny snippet? So
And
this is
whatever,
also,
yes.
I'm hyping us in the Zoom room as well. Many of us are co-authors on an upcoming supplemental issue of the American Journal of Public Health, really showing and demonstrating. And again, I'm looking at Julie, I'm looking at so many others who are co-authors who are saying and really demonstrating through that supplement that TA works initially, midstream, and also at the end. And so programs that are able to optimize their own and really maximize their own full potential to be able to improve health outcomes, to be able to support CHW's well, are programs that don't try to do it alone, don't try to invent things they don't need to invent. Again, looking at our friends at C3, they're folks who really lean on trusted experts and guides to be able to support them along the process. And they themselves build capacity to be able to do the same work even better next time. So just want to amen everything you're saying, Erin, and hand it back to you.
Thank you so much. I have room for one more question. I'm so surprised you guys didn't have a lot of questions throughout the webinar, but please put it in the chat. I'll give you about 20 to 30 seconds or so, because guess what? We are wrapping up our time. We have about 1 minute, and I need y'all to fill out this poll. So it's not a nothing's ever a requirement, but we would love to hear your voice before we get off the call. With that being said, I can wrap it up, though. If there's any questions coming in the chat, I'll try to get them to them before we wrap up. We are going to put a poll in there just to gauge to see if you learned anything, if this is really helpful for you. But I do want you all to realize that we talked about how technical assistance helps move our programs from plans to practice, and really from those ideas to implementation, and really the long-term goal of sustainability. We had a lot of great experts on the call. We had some people and some programs that have benefited from technical assistance. So all of us today are just showing you that with you being excited with building those CHW programs, TA is here to support. TA is here to help you be sustainable. Of course, we can't always say it's always going to end the greatest, but if you do have this support alongside of you, you have that recipe and you have that guy, that good chef that knows how to do things, more than likely the end result will be great, and you'll make a good old meal and your community will love you for it. So with that being said, Rich is going to launch the poll. I know it is 3:30 and a lot of people have to go, but he's going to launch the poll. Please answer. And if you have any questions, all of the information was on the side. Contact us. You have all of our information, and we would greatly, greatly appreciate your feedback. So thank you so much. Again, this will be recorded, and as the PowerPoints will be available and will be posted on both the Envision and the Teacher website at a time coming up soon. But we appreciate all of your time, and please do not log off until you complete the poll. We thank you for your time, and thank you everybody, all the guests, all our panelists today. We appreciate you giving us your expertise. So have a great, great day, everyone, and we will see you soon. Thank you so much.